Hi there, and welcome to this video on the Dentistry Interview, focusing on the topic of the future of dentistry. I'm Alice from Dentist Mind, where we go through the important topics of the dentistry interviews. Whichever university you're applying for, MMI or panel, we've got you covered. If you're new here, be sure to click that subscribe button. Whilst you're watching, please leave any comments below if you're unsure about anything. We've got helpful timestamps below for each part of the video to help guide you. The following video is a free sample of our full interview course, which you can buy by clicking on the link below in the description. So, let's get started. Welcome to Lesson 10 of Dental Conditions. This time we're looking at the future of dentistry. There's been a vast technological development in recent years, with dentistry becoming faster, easier and better, and most importantly, more enjoyable. Dentistry has been at the forefront of technological development in its area. However, it has been held back a bit by funding, particularly from the NHS. On this slide, we have a few areas of development which have occurred in dentistry. So if you do get asked a question about this in your interviews, it's a good idea to have a few of these in mind to talk about with your interviewer. So some of the areas of development that we have here are implants, digital X-rays, CADCAM Technology, Veneers, lasers for cavity detection, and Invisalign, all of which have occurred due to technological developments in recent years. We'll discuss each of these in more detail on the coming slides. So one area of technological development has been in implants, and it took about 25 years for these to become widespread and used in dental practice. Thanks to this, there is now higher efficacy, both in terms of cost and time for giving patients dental implants. There's also improved accuracy compared to previous techniques, which means that implants are more likely to survive long term. There's also a higher level of predictability of the outcome of having an implant, so now we can tell patients reliably how long this implant should last, based on evidence that we've gathered, and also take into account different patient factors with regards to how likely an implant is to survive. Another area of technological development has been in the use of digital X-rays. This technology has been around for a while, but only recently have many dentists started to adopt it. It's better for the patient as there is a lower dose of radiation from digital X-rays compared to the traditional film that used to be used. Furthermore, it's easier for a dentist to store these images and to compare digital images to those taken at previous appointments, rather than having physical copies in front of them. Another area of development has been in CAD-CAM technology. CAD stands for Computer Assisted Design and CAM stands for Computer Assisted Manufacture. Traditionally, a dentist would take a mould of a tooth and then send this off to the laboratory to make the crown for them. However, with CAD-CAM technology, a dentist can prepare a tooth for a crown and then take a scan of it. They can then use CAD technology to design a crown and CAM technology to 3D print it. Another area of development is in the use of veneers. Veneers are basically shells which go on the front of teeth to improve the aesthetic appearance. For example, if you have crooked teeth or discoloured teeth, you may have a veneer placed. Technological advances mean that veneers can now be made thinner than they ever used to be. So when you're preparing a tooth for a veneer, the dentist will remove the front layer of the tooth to make room for the material of the veneer to sit on. Now that the material can be thinner, this means that less tooth tissue has to be removed, and more natural tooth can be retained, which therefore helps to retain the tooth in the mouth for longer, as natural tooth tissue is always better than anything artificial. Another area of development is the use of lasers for cavity detection. So traditionally, a dentist would use an explorer to see if a patient has any cavities, but now they can use these high-tech lasers to scan the teeth and determine if there's any caries in them. Once the dentist has this information, they can then make a decision about whether to monitor the teeth, to treat them, or maybe even have the tooth filled immediately. So another area of development is the use of lasers for cavity detection. Traditionally, a dentist would use an explorer to see if a patient has a cavity, but now they can use these lasers which detect cavities within the tooth. This will tell the dentist if there's any decay there, and they can then make a decision about treatment. So whether they just want to monitor the patient over time, or they want to fill the tooth, for example. The final area of development we're going to talk about is Invisalign. This is basically a clear brace which helps to realign teeth compared to the traditional train track braces that you might be used to seeing. It's an effective and comfortable way for patients to straighten their teeth without having to wear these heavy, awkward braces. They're easy to take out for cleaning, and it doesn't dictate what type of food you can eat either, because with traditional braces you don't want any sticky food that's going to get attached to them, whereas with Invisalign you can take them out when you eat, and therefore eat whatever foods you want. The Invisalign braces get the job done in less time with less hassle, and therefore a lot of patients will prefer this technique. That was lesson 10, and lesson 10 is now complete. We've now completed the tutorial and dental conditions, and I hope you now have a lot more understanding about different things you could talk about if you get asked questions about any of these conditions during your interviews. If you like this video, make sure to subscribe by clicking below, and please leave a comment. Click here to continue watching our interview series, and to unlock full access to 70 tutorials covering core interview topics, MMI mocks, top tips and more, click on the link in the description below.